Hey guys, it's Dr. Braddock at Braddock Chiropractic in Van Alstyne, and I want to show you something that I think is super cool. I think you're really going to enjoy this. This is kind of an antique, if you will, anatomical model of the base of the skull and the top two bones of the neck. And I'm going to explain what I think is so cool about this in a second, but one, I'll tell you that this actually means a lot to me. Now, there used to be a chiropractor that practiced in Van Alstyne. His name is Dr. Hall. And he had a practice here for years and years and years. So a lot of the old timers that I take care of used to see Dr. Hall a long time ago. He's since passed away, and I never actually had the opportunity to meet him. He had passed away just a year or two, I believe, before I came to Van Alstyne to practice. And one of my patients had kind of through the grapevine been able to get their hands on all of his old spines and models. I have all of his old chiropractic textbooks that were copyrighted like back in the 40s. And so going through chiropractic school, we had, you know, the most state-of-the-art models and 3D representations of everything. But I've never in my life seen an upper cervical model with this that it was as realistic and that moved, that had the freedom of movement that we're looking for. So I really cherish this, and I was explaining a couple of details to a patient that I was working with this morning, and I used this model, and I thought, you know what, I'm going to take a second just to kind of explain a few things that really, when you think about it, are just really big concepts. So just so you know what you're looking at. So for some people, this is still a little bit foreign. You're not even sure what I'm holding up. This is the spine model. Okay, so this is you from behind. This is you from the side. So if I was facing this way, and you can see the base of the skull here, and then the top two bones, that is essentially all that we're looking at when we look at this, if that makes sense. Now, we call that top bone of the neck, the very top bone of the neck, is called your atlas, and that's what I want to talk to you about today. If you are into Greek mythology, you know, Atlas was like the primordial titan that held up the celestial spheres. You know, that was the guy at one knee holding up the world. And the reason that anatomists called this bone the atlas is because it literally holds up your world. Okay, we have basically about a 2-ounce bone that holds up approximately a 10-pound head. And just like a small tee on the golf course that will hold up a large golf ball, as long as the tee is arranged properly. If the tee's going straight up, that golf ball can sit on there nice and steady. If the tee is tipped one direction or the other, it's virtually impossible to keep the ball sitting on the tee. You can imagine that your atlas has to be in a very specific position to allow your 10-pound head to rest naturally on there. Anything not natural, anything that's causing your head to tip one direction or the other, is going to start to put a lot of stress and pressure on the muscles and soft tissues in the area, and most importantly on what runs inside the atlas. So I'm going to show you that now. This that we talked about is the base of the skull. We've basically lopped this person's head off. Forgive me for being morbid here, but if we look down, all the way down in here, you can see the space that we can see each other through there. That hole in the base of the skull that allows the brainstem to exit is called the Foramen Magnum. And early anatomists actually referred to that as the mouth of God. And the reason they did that is because literally all the God-born innate intelligence, all of the information that heals and operates your body on a daily basis, whether that's digesting your food, creating hormones, putting your right foot in front of your left foot, all that information, those instructions come from the brain, okay? We call that innate intelligence, your body's ability to self-heal and self-regulate. Innate, God-born, it's within here. The only way that it gets from the brain to all the parts of the body is through the nervous system. We're constantly talking about the nervous system. I think this is super cool to see. I mean, even the early anatomists, they had it figured out. This is the mouth of God to them, and that spinal cord runs right through here. You can see that if we were to shift that atlas out of position, what's happened to that hole? It's gotten smaller, okay? So when things are out of position, the hole that the spinal cord runs through is going to start to change dramatically and put pressure on the brainstem. Now the brainstem, particularly that top part, that's the medulla, it's going to control things like sleep patterns, hormone release, energy levels, immune function. Those type of things are all contained there in that upper cervical spine, or the very, very, very top of your spine at the base of your skull. So if you were to take your finger, put it just behind your ear, right under that lump of bone, and push in there, you're actually touching the atlas. The amazing thing is just a few minutes ago, like literally 15 minutes ago, I got a chance to adjust a beautiful little 3-day-old girl named Audrey, and her parents brought her in to be checked, not because she had sciatic pain, right? She was not involved in a car accident. They brought their brand new infant, their tiny, tiny baby, to be checked because they know that when those bones shift out of position, it can cause a lot of stress and a lot of pressure in the nervous system. Birth is one of the most traumatic events we go through. Now, whether that's done in a birthing center the way this was, or whether it's done with an OBGYN, or whether it's a cesarean, or whatever situation it has to be to get the baby out, just the stress and pressure of actually bringing that baby's head, a large head out of a small opening, can start to put a lot of pressure on the atlas, and it can start to damage that area, and we can see everything from colic and croup and attention deficit, and particularly ear infections. This seems to be kind of an area that ear infections tend to start with as well. So I'm not going to bore you anymore. I don't know if you think it's as cool as I do, but that atlas, right? It's holding up your world. All the information that God put inside of your brain is actually transpiring and going right down through that foramen magnum, down your spinal cord, out your nerves, and it's actually animating your body right now. Okay? It's what's making you alive. It's what's allowing your body to flourish and function properly, or what could be preventing your body from flourishing. Well, you know, what's causing you to actually wither or deal with sickness and disease. That's why we take a very specific set of x-rays, and we want to determine any areas in your spine that are actually starting to fail or could be damaging your nervous system, and we want to work our tails off to correct that and take the pressure off the nerves so your body can heal and function the way God designed it to in the first place. I hope this has made a little sense. I hope that you have an awesome day, and I look forward to seeing you soon. God bless.